everyone. Thank you for the introduction. I am really grateful to be able to present here. I would like to introduce my PhD topic, which is biomarkers for the assessment of rheumatological diseases. Biomarkers are measurable biological markers that reflect certain biological processes and indicate the medical state of the patients objectively. With today's medical viewpoint for precision medicine, there is an unmet need to find specific and sensitive biomarkers for the assessment of the diseases. I'm a medical doctor and a PhD student. My personal vision is personalized medicine, in a sense to find each of patients the most beneficial treatment with the most optimal intensity. In the last 2 decades, there has been a huge drug development in the medical field. However, there is a gap in knowledge for medical doctors how to find the right treatment for the patients. So to approach this vision of mine, my mission is to find specific and objective measurements in rheumatology, and with the help of these objective measurements to optimize the already existing therapeutic options. My specific goal is to perform 2 meta-analyses in the field of biomarkers, one regarding rheumatoid arthritis patients and one regarding psoriatic arthritis patients. So the first topic of my meta-analysis is investigating the clinical value and utility of the multi-biomarker disease activity score, its correlations, predictive and discriminative value for monitoring rheumatoid arthritis. Rheumatoid arthritis is a chronic autoinflammatory disease with a prevalence of 0.5%, and with the evolving options of treat-to-target and biologic therapies, it is an attainable goal to have these patients in remission. However, intensive monitoring is crucial to attain this goal. And nowadays, mainly subjective and non-specific monitoring parameters are used for the assessment of rheumatoid arthritis patients based on patient complaints and non-specific inflammatory markers. And the problem is that these are influenced by non-inflammatory pain and inflammation outside of rheumatoid arthritis. Researchers have developed the multi-biomarker disease activity score, which is an algorithm based on 12 serum biomarkers, and the aim is to have it as an objective parameter with a potentially diverse clinical utility. So during my first meta-analysis, I would like to investigate comprehensively the multi-biomarker disease activity score based on the aspects found in the literature. So my PICOs are regarding the different aspects. So the first PICO and clinical question is to investigate the correlation of the MBDA score to the already existing disease activity and radiologic measures. And the second one is to investigate its predictive value for radiologic progression, therapy response, relapse, and remission. The third and fourth PICOs and clinical questions are according to the discriminative value of the MBDA score for disease activity levels and therapy response. The clinical implication of this meta-analysis would be to have an objective parameter for monitoring rheumatoid arthritis, and with the help of having this parameter to optimize the therapeutic options for the patients. A systematic search has been conducted in 5 different databases, and we began the selection with over 1,000 articles, and after duplicate removal, title and abstract, and full selection, I'm now working on the data extraction from 56 eligible articles. My second meta-analysis topic is investigating serum biomarkers for differentiating psoriatic arthritis patients among psoriatic patients. So psoriasis is a chronic autoinflammatory skin disease, and about in 30% of the cases, psoriatic patients develop psoriatic arthritis. And in 70% of these cases, skin symptoms precede the joint symptoms, which makes this population appropriate for screening. Nowadays, mainly screening questionnaires are used to detect this patient population. And besides the fact that there is a high prevalence of undiagnosed psoriatic arthritis patients, even before the onset of psoriatic arthritis, there are discrete changes in these joints. So our aim for this topic is to find serum biomarkers that could help the early diagnosis of this patient population. The clinical question of this meta-analysis is which biomarkers can differentiate arthritis psoriatica among patients with psoriasis. And during my investigation, I would like to compare the serum level biomarkers of patients without arthritis to the patients with arthritis psoriatica in a population both having psoriasis. The outcome would be that which biomarker can differentiate the presence of psoriatic arthritis. The clinical implication is to help the early diagnosis of psoriatic arthritis patient population, and with the appropriate treatment of these patients to prevent their joint destruction and maintain their quality of life. We have developed a search key, and now we are just ahead of the Prospero registration with this meta-analysis. Here is an overview about my ongoing topics. And I would like to thank you for your attention with a quote from Albert Schweitzer. Success is not the key to happiness. Happiness is the key to success. If you love what you are doing, you will be successful. Thank you for your attention, and I am happy to answer your questions if you have.
Eszter, can we go back to your first slide, to your first PICO?
Yes.
Well, this is quite complex, but I'm innocent on this topic, you see. I have relatives actually who have wrote, but I try this kind of stuff. So is that really easy? High stage disease severity and low stage disease severity, and also therapy of responders and therapy of non-responders. Because, the problem is the definition, that different papers have different definitions for this. So are there really, are you down there, digging in the data, that you can have a clear picture or not?
Yes, thank you for the comment. This is actually a difficulty with our project because it is really heterogeneous how medical doctors determine the therapeutic response and the disease activity levels. However, we are looking for data that where they define these appropriately, and we will see based on the found data how we can compare these to each other.